So back to what the governor said about Omicron. The Omicron variant of COVID-19 is probably one of the most transmissible or contagious infections we've had in the last century, at least. To put this in perspective, one person who gets influenza may infect 1 to 2 other people. The Delta variant really escalated COVID's transmissibility, and one person with the Delta variant may infect up to 5 other people under the right situations. Omicron now, it may be that one person with Omicron could infect up to 18 to 20 additional people. So, this is not the progression we want. The virus continues to get more effective in certain ways. And so it's more important than ever that we take the benefit of the things we have learned over the last nearly 2 years so that we can take relatively focal steps to minimize its spread, to minimize the harm it causes, and still be able to go on with our lives. This virus also, Omicron, because it is so transmissible, doubles in a community incredibly quickly. So we were telling you as recently as this past week that virtually everything in Kentucky was Delta virus, or the Delta variant. Now that we found it here, and we found it in the three big metropolitan areas, it will spread incredibly rapidly. So we can effectively go from 0, and if you start doubling things, 0 to 1.5 to 3 to 6 to 12, we could go from Omicron not being present at all to Omicron being half or more of all the variants of COVID in the state in the span of just a couple weeks. And in fact, over the span of about a month, it could outcompete everything else. And just like Delta wiped out the other competitors for the variants in about 2 months, this one could do the same thing in a month or less. So folks, it is clearly a different chapter in this journey. The good news, should there be good news with this, is that so far in the countries most impacted by this, so South Africa and United Kingdom, while the numbers have spiked dramatically, the hospitalizations have not yet shown the same kind of spike you would have seen. Now, that doesn't mean it's not dangerous and important. It doesn't mean that they haven't had increases in hospitalizations, but the proportionality appears to be less, and that's really, really important. Now, in the United Kingdom, they have a very highly vaccinated population, particularly in the elderly population. And South Africa has a younger population. So there's a lot of complexity when you interpret these, but we're going to have to hope that it is less severe and that hopefully that helps to give us a little bit of a reprieve from the harm that it might otherwise cause. So on vaccines, so mRNA vaccines, Pfizer and Moderna, are still effective against Omicron. Now, you need to have that booster dose. It makes a huge difference. If you get a booster dose, we feel very confident that Pfizer and Moderna vaccines are going to provide very good protection against severe disease and death from COVID-19. That's the good news. The disappointing news is that Omicron is so effective at infecting people that the breakthrough cases are going to go up. And so the number of people who are even fully vaccinated and boosted who could have mild disease, so think about having cold symptoms, will go up almost certainly. But remember, the vaccines, if they keep you from ending up in the hospital and they keep you from dying, they have done their job. That is the most important stuff we ask of them. And the evidence now is a fully boosted person with an mRNA vaccine is still very well protected. In Kentucky, 17% of the state is fully vaccinated and boosted. We need more people to go out and get boosted, please. It's widely available at the pharmacies. It's available at more doctors' offices than before. Federally qualified healthcare centers, rural health centers, please go out and get your booster. That's anyone 16 and older who is more than 6 months out from your second dose of an mRNA vaccine. Please get boosted. 62% of all Kentuckians today we believe to be fully vaccinated. We need everybody in that population to go get vaccinated and or for the first time and or get boosted. In some counties, the proportion of people vaccinated is less than 1 in 3. Folks, that's a recipe for disaster, particularly with something like Omicron, because if it sweeps through your community, it'll hit everybody, hit quickly, and that's a recipe for disaster. So please, we're just trying to help you and help keep you safe. I hope you'll be open to going and getting vaccinated. It's widely available. Data is showing your prior infection with COVID is unlikely to be sufficient to protect you from reinfection. So even if you have had COVID, If you get vaccinated with an mRNA vaccine, that will really protect you far, far better. We'd urge you to do that. A word on the Johnson & Johnson vaccine. The CDC issued new guidance just in the last few days. mRNA vaccines are now clearly preferred over J&J. So it is going to be a very clear preference, and I would suspect everybody who goes out and gets newly vaccinated now probably should just go get Pfizer or Moderna. And if you have previously had J&J and not yet been boosted, 2 months after your J&J dose, you should go out and get any one of the mRNA vaccines, Pfizer or Moderna, and get boosted. The pharmacies and others will allow you to pick whichever of the two you prefer. A word on monoclonal antibodies. These have been very helpful for people to minimize the risk of progressing to severe disease and death. They've been very effective against the Delta variant. Bad news is 2 out of the 3 of those monoclonals do not appear to be effective against the Omicron variant. And the worst news is that those 2 that are not effective against Omicron are the ones we have the most of. So you cannot wait to get sick and then hope that the monoclonals will rescue you. Now more than ever, I would say vaccination is so important because that will work against all of these variants to help minimize the risk of severe disease. We've got a wonderfully robust monoclonal distribution system set up now in the state, but if we don't have effective monoclonals, they won't have anything to offer you. So folks, please go get vaccinated. You can't count on the monoclonals. Now, if they design new ones and they're effective, of course, we'll be ready to distribute those immediately, and our sites across the state are ready to administer them. The Merck and the Pfizer pills, again, every little bit helps, but I want to offer a little caution on this. The Merck pill, unfortunately, the more final data showed it was only about 30% effective, preventing the progression from mild to moderate disease to severe. It must be started within 5 days of symptom onset. You must have a positive test to confirm your infection before you can be given it. You cannot be pregnant or trying to get pregnant or possibly going to get pregnant in about the week after you have the medication. So there are some restrictions. And the supply will be extremely limited. So folks, it will be very, very difficult to get this for many months to come until they escalate production. So even though we will make it available as soon as we have it, and we don't have it yet because an authorization has not yet been issued, you cannot rely confidently that you'll be able to have access to it. That's just a supply situation and nothing else. The Pfizer pill, the data looks better. It could be up to 89% effective, but you have to give it within 3 days of your symptoms starting. So the window is very short. And again, the amount of supply that will be available both won't come to us until mid-January or later probably. And if it's approved, and it hasn't gone through that yet, and the supplies will be exceedingly small. So again, over time, hopefully these therapies will be helpful and enable more people to be treated effectively if they get infected. But you cannot rely on that during this Omicron surge. It's going to take more time. And on testing, we are distributing Binax Now cards to local health departments and a number of other settings for rapid antigen testing, and also Ellume, which is another at-home test. We're using these in the tornado-affected areas to distribute them, so they have them at shelters and at local health departments and other settings. They do work for finding Omicron. That's the guidance the FDA has given. So you can use those with confidence. And now I'm going to wrap up and say, as we look to the holiday season, and obviously as we look at the impacted areas in Western Kentucky from the tornado, they're the holidays. We have to still find ways to enjoy each other's company and celebrate the holidays. There are things you can do. If you are sick, if you are sick, you have a fever, a cough, a runny nose, a sore throat, stay home, please. Do not go to school. Do not go to work. Do not go to a party. If you are sick, the easiest thing we can do is not knowingly spread infection, no matter what type of infection it is. The second is please get vaccinated for COVID. And also, please get vaccinated for influenza. The strain this year is the H3N2 strain. It's associated with a little bit worse disease, but the current vaccine this year does contain that strain. So this year's vaccine should be very helpful. Please get vaccinated for COVID and get vaccinated for influenza. Third, when you're indoors around other people, certainly in public spaces, and definitely when you're close to people, please wear a mask. If you're going to be in an indoor space for an extended period of time, upgrade your mask. For those of you who are attentive, and I know there are people out there because I get comments, I have an N95 now. So I've upgraded my mask when I'm going to be in an indoor space for an extended period of time. This virus is much more contagious, the Omicron. So if you can upgrade your mask in those situations, I recommend you do that. If you're gathering with family or friends for the holidays, and yes, I'm not naive, I know you're going to do that. If you do that, if you can find them, go to a Walgreens or a Kroger or a Walmart or any other chain pharmacy and buy in-home tests, the antigen tests. If everybody can test themselves before they go into the party and everybody's negative, that is going to lower your risk tremendously. And that is what the future in 2020 looks like. The federal government's going to distribute more than 300 million tests, hopefully over the next 3 to 6 months, and dramatically escalate the production of those and make them more available to empower all of you and all of us to take the responsible steps to test ourselves before we go into these situations, remove ourselves from them if we are infected, and still be able to have some confidence we can get together, share time and enjoyment with each other while not spreading COVID. And if you do test positive, please don't go out of your house. Stay there for 10 days after the positive test or your symptom onset, whichever was first, and only leave if you need to go get medical care. Otherwise, stay home just so we don't spread this. And the very final thing is, if you are 60 or older, or if you have any major medical problems, even if you're vaccinated, you should really be very thoughtful and consider, do you go into situations where you're around a lot of other people who may not be vaccinated or even who are vaccinated? Because even though they will be protected, hopefully, from severe disease, they could still infect you. And we know that this is a very age-dependent disease. So if you're over 60, the risk is much higher. So please take those steps. And I want to just emphasize what the governor said. School settings and places of employment, none of us want to go back to this, believe me. Your health professionals are as exhausted as you are, but this does work. It does lower the risk. Is it perfect? No, we've never said it was perfect. Is it incredibly helpful? And is there now a mountain of evidence that shows these reduce the spread? Absolutely. So I would urge you, protect yourself if you're vulnerable. And if you're in settings where there are vulnerable people, I would ask you to exercise some kindness and care and try to protect them as well by wearing your mask. Thank you very much, Governor.